Hi everybody, my name is Janine and I'm a labor and delivery assistant nurse manager at a hospital here in Ohio. And I'm here today to talk to you about, because you're a new nurse and you're probably thinking, oh my gosh, I'm overwhelmed. Nursing school is bad enough, and I thought I might be alright when I got out of nursing school because I did all my clinicals, but I am overwhelmed. Or you're a nurse who is working in a different department and now you switch departments and now you're like, oh my gosh, I totally made a mistake, I am overwhelmed. So how long should you give yourself before you say, I'm not going to be a good nurse? I need to go work, as a teacher. Or I am not a good nurse in OB where I work. I got to go back to the ER. Give yourself a year. That's how long I say. That's what I tell all my orientees because we get 12 weeks orientation. When they're done with their 12 weeks, send them on their own, and I say, give yourself a year from today, not the beginning of your orientation, from today. If you are not good in a year, you're not going to be good. There's special people that can work in labor and delivery, and it just might not be for you. And I've had a few nurses that have given it that year, and at the end, I've had one say, I don't like this. I don't like that I can't see what I'm monitoring in somebody, and you never know what you're going to get. That's true. She goes, and I didn't even realize that before I started. She goes, I thought I knew, but I didn't. And then the other people I've seen quit because they don't like the schedule. You have to know that as a new nurse, you're going to be on night shift, you're going to work weekends, and you're going to work holidays. That's the sad thing about nursing. You got to put in your time. And even when you put in your time, you sometimes don't get what you want because it just doesn't work for the unit, or you got to worry about safety of everybody. And then it's very demanding, it's very emotional, and a lot of people can't handle a lot of the emotions that go along with it. I've caught nurses, taking care of demises, and I catch them in the locker room crying. It's like, hey, you don't need to sit in here alone and cry. It's very sad what you had to deal with today, or you have to. A lot of people quit probably because they don't like their coworkers. Fortunately, I should say, in my unit, we all get along. Most people say I would leave if it wasn't for my coworkers some days, if it gets really bad on our floor. And that's the reason I won't leave night shift. It does work for my family, but I have a great crew on my shift right now. So I would say give yourself a year. If after a year you don't feel right, you don't feel a little bit more comfortable, you probably never will. And learn that first year. You're gonna feel overwhelmed. Take those hard patients because that's how you're gonna get to good at what you're doing. It's scary as all heck. Don't get me wrong. Taking patients that may seize or may bleed out or may need a C-section, it's okay because you have people that got your back. They know you're new. And just tell your charge nurse, tell your fellow coworkers, hey, I've never done this before. Can you help me with this? Or hey, I've never done this before. Can you just double check this? Because I think I had it right, but I'm just not sure. Nothing wrong with that. We, as older nurses, look at people like that and think she's going to be good. She's going to be good because she took that patient and wanted to take that patient. As a new nurse, I remember taking the hard patients going, I got to do this, I got to do this. And I don't regret it at all. Sometimes you get screwed and you get the hard ones when you're like, I just want a nice night. But that's life, that you're going to get the harder patients sometimes, and some nights you're going to have an easy night. You never know. And that's every floor you're on. There's critical patients in a regular med-surg floor too. It's just the luck of the draw sometimes. The new people, they always try and get the hard patients too. It's not because they don't like you, it's because they want you to learn. And just know that. Just know that they're not trying to screw you over. You already feel overwhelmed, and it's okay to get in your car and cry sometimes and go, I don't think I'm going to cut it here. You will. Just give it time.